much, moderator. I want to thank everybody who has made this a reality, with special thanks to the governor who has granted me the permission to organize this conference, and to all of you, especially Dr. Chukwuma, Dr. Nyoko, and all of you who have contributed in one way or the other to set up this event. I'm deeply, 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 deeply grateful. His Excellency is unavoidably absent because of office exigencies. Like I explained earlier, he would have been here, but for the reason of ESCO meeting, which is specifically for budget defense, and all ministries are requested to be in the ESCO chambers right now. For the importance of this event, commissioners for education, Dr. Elan Donatus, and his colleague, my colleague, health, Dr. Ekoma, have also made our time to be on this platform. ESCO is going on, but they were excused to talk to us. You can see like he's waiting in the car. Shortly, he will talk to us. So the governor is very appreciative of your efforts, and he hopes that the record of proceeding will be transmitted to him, which in his own way will help him shape his administration for the progress and peace of Ebonyi State. So on this note, I want to officially declare this conference open in the name of God the Father, the Son, and the Holy Spirit. Amen.
Amen. Thank you so much. Thank you so much for a wonderful opening. And so we want to then call on, we want to start off with Commissioner for Education, Dr. Donatus Ilang, to kindly address the floor. You're welcome, sir.
Thank you. Good morning, everyone. More appreciation, moderator, and Commissioner for Special Duty for those efforts together with yours set up this conference to enhance the government policies of Ebonyi State towards effective implementation. Well, my name is Dr. Elan Donatus, Honorable Commissioner for Education, Primary and Secondary, Ebonyi State. I want to really appreciate us once again. I want to also let us know that His Excellency Ade, the Governor of Ebonyi State, the vision bearer of our state, has done so much, and I will be mainstreaming this was combining the theme of today's conference that says Ebonyi 2050 strategic foresight. But I would point that in education, where I am representing. In education, I would tell you that this is a policy strategic plan that is in line with the Excellency's People Charter of Need in Education, which is basically on skill acquisition, entrepreneurship, and education for self-reliance at all levels. Sorry for such interference from the court. So it's an educational policy that is meant to provide to Ebonyians what we can call a smart school system. This policy strategy has its effects in solving the essential problems of providing solutions that will provide digital educational system for Ebonyians. Because of time, I will go straight to these issues that borders on achieving effective and qualitative education in Ebonyi State and the action plan therefore. One of its kind is ensuring that we have action plan for solving the data structures or provision of sufficient structures. And I'll be combining what His Excellency has done on this. And towards this, His Excellency has strategically mapped out provision of effective smart schools which he has started. He started with number 3922 classrooms that will be equipped with every available school standard structures, effective laboratory, effective library, effective ICT system, and these schools are one of its kind that represent smart school of both national and international standards. Then we also have action plan for teachers enrollment. The teachers enrollment, as you all know, that once you have good number of quality teachers, that the quality of learning and teaching increases and effectively increases the understanding of the students. This is meant to provide effective space to teachers to people's ratio that is of national and international standards. And His Excellency, our dear Governor, has also mapped out this strategic plan and has taken effect on it by employing 2,000 teachers, 1,000 for UBEC, which is basic, and 1,000 for secondary. And these people has already been injected into the system. Then the issue of ICT, which is where the world is going now. His Excellency, in its magnanimity, going front, has established ICT University. Away from this, like I told you that the smart schools has already started.
Probably network.
Sorry, is network.
Gentlemen, that's calling me now, please.
Yeah, don't worry. I think Dr. Eni, you can take up because it seems he's receiving some calls.
Okay. All right then. Thank you so much, Dr. Donatus. Dr. Donatus was speaking to us about the various interventions of the government, the smart schools, for instance, in the area of education. So thank you so much. And we'll come to Dr. Moses Ekuma, the Commissioner for Health. Thank you, sir. Dr. Moses. Dr. Moses, are you there?
Hello.
Yes, sir.
Good morning, ladies and gentlemen.
Morning, sir.
Good morning.
Morning.
Please, for want of time, just as Dr. Honorable Valentine has said, we are about commencing the ESCO meeting in which we are to defend our budget. So without wasting much time, I will just go straight to what we've done what His Excellency the Governor has done in the health sector. Actually, the vision of His Excellency the Governor of Ebonyi State, Right Honorable Francis Ogbonnaya in the health sector, is to provide quality, affordable, and accessible health services to all Ebonyi residents. And that is summarily what the vision of the government is in the health sector. And that has been backed up with action, because when this government came in, we quickly assessed the health facilities in the state, because we cannot provide all this without functional health facilities. So that we discover so many gaps, including that of a human resource, that of lack of equipment, lack of human resource. Hello?
See me here now.
Go on, sir. I'm trying to meet this person.
So that we identified lack of human resource, lack of equipment in our health facilities, and lack of drugs in the health facilities. So without wasting much time, the government went into action and recruited health workers of different cadres, including medical doctors, the pharmacists, lab scientists, nurses, the group we call community health extension workers, optometrists, and so on, so to fill the gaps. And we did not only stop our recruiting because we know the problem in the health sector of the country that due to poor incentives, many health workers are leaving the country. So we decided to give incentives to all these workers so as to retain them. And His Excellency provided SUV for all the medical officers working in our state Ministry of Health, brand new one, and did not waste time also to increase their salary. He added the fuel allowance to their salary also up to 150,000 per month as a fuel allowance in addition to the car he gave them. And we also went into renovation of the quarters, the medical officers' quarters in our different general hospitals, made it conducive for them, and started paying rural posting allowance, such that some of the health workers now wants to go into rural area because they know that if they are there, there is additional allowance for them. So all those things helped in retaining health workers. In fact, as the National Council on Health is going on, federal government is adopting the Ebonyi standards to make sure that they retain the health workers in the health sector. Then even if you have the best health worker and you don't have equipment to work with, that there is still a very big gap. So we listed the essential equipment, basic equipment that are needed to keep the health hospital functional. And that has been procured and distributed to all our general hospitals and selected primary health care centers. We looked at the issue of drugs being available in the hospital. We discovered that before now, government used to release money for drugs to be procured, but sometimes after procuring the drug, after some time, you will not see the drug and you will not see the money again. So we now propose a bill which was passed by the House of Assembly and signed by the governor into law. And that bill, that law now established Drug and Medical Commodity Management Agency. And this agency is charged with the responsibility of procuring the drugs directly from the manufacturers. So by procuring directly from manufacturers, it makes the drugs cheaper, and also the issue of fake drugs will now be things of the past. So, and that has been done, a fund released to that agency. So there is no any of our health facilities now that we are having challenge of no drug or no consumer. So these are the three basic things for our health facilities. But after all those things, we also discovered that there is still issue of people not accessing health care because of fund. They don't have money. Sometimes somebody will be waiting after salary before we go to hospital for a serious medical condition. And that we presented to His Excellency, and he now approved health insurance for all the staff of, for all the civil servants in Ebonyi State government, both the civil servant and the public servant. And he also released equity fund for those ones, the vulnerables, because we are receiving support from the federal government to enroll vulnerable group into the health insurance scheme. So that has increased the number of enrollees into the health insurance scheme. Before we came in, we had less than 6,000 of Ebonyians into health insurance scheme. But as we speak, we have over 140,000. But we know that is not enough. But when you compare it to what we met on ground, you know that there is a significant increase. And they also thank God for Her Excellency, the wife of the governor, who has been enrolling all the pregnant women into the health insurance scheme to access free antenatal and free delivery, as well as even gives incentives like a mama pack for those women when after delivery. And all this intervention has actually paid off in the health sector, because one of the major things we wanted to do is to reduce the maternal mortality in the state. But when I came in as the commissioner, the maternal mortality rate in Ebonyi State was over 800 per 100,000 live births. What that means is that if 100,000 women should deliver, around 800 of them will die. So, and we said no, that pregnancy is not a disease. People are supposed not to die from it. Because of that, we started those interventions. And as we speak, the maternal mortality rate of Ebonyi State is about 412 per 100,000 live births. That is below the national average, because the national average is about 500 and something per 100,000 live births. And this was done within 2 years. So I believe that by the time His Excellency completes his first 4 years in office, that the issue of maternal mortality in Ebonyi State will be a thing of the past. Also in the area of under 5 mortality rates and neonatal mortality rate, all those things has dropped, showing that the intervention we are doing in the health sector is actually working. As regards the primary health centers, what we did is we have 171 political wards in Ebonyi State, and government has decided to select one primary health center in each political ward to upgrade. And that we've done. We've revitalized 171 primary health centers, but we have over 500. So we just selected one per political ward, and we're having 171. So, and we are in the process of selecting another one that is like making it 2 per INEC recognized political ward to revitalize. And there are some special centers we've opened. That is about 25, 2 in all the local governments to augment the general hospital. Those ones we are providing water, we are providing a solar system, we are fencing the health facilities, providing accommodation for the staff, and in short, is more of a cottage hospital. It's more than a primary health center. Those ones are 2 in a local government. If you lecture any of the local government, I can even get the place where we are building those ones and send to across. So that is about the primary health centers. And we look at the issue of immunization, because as the popular saying goes, prevention is better than cure. We look at the immunization coverage in the states. It was low, and we quickly assessed and noticed that some areas are difficult to access. And the governor approved the procurement of motorcycles to health workers in those rural areas, so that during immunization exercise, they will access even up to the last, the most remote area, so that the health workers can access those places and give immunization to our children. I also looked at the condition of our cold room where we used to store this vaccine. You know, for people that are medically inclined, you know that if these vaccines are not stored in optimal condition, its potency will be reduced drastically. So, and we are using a public power supply. We said no, that we can supply, because we want to be sure that what we are giving to our children are actually potent vaccine. So, His Excellency approved the solarization, complete solarization of our vaccines cold room. So as we speak, all our vaccines cold room are completely solarized and are independent of public power supply. What that means is that even if any injection or any vaccine from that cold room is potent. It's not like because the temperature affects the vaccine's potency. And since that has been done, we are sure that what people are receiving or what our children are receiving are actually what they're supposed to receive. These are some of the intervention in the area of immunization. And we employ so many health workers, community-based health workers for our primary healthcare facilities. We also employ the ones that are to link the community to the health facilities. They are not really health workers, but what we want them to do is, since they are residing in a community, they should move around. If they see any pregnant woman, they ask the woman if the woman has booked or registered in any health facility. If no, they should link that woman to the nearest health facility, because we discovered that some of, despite what we are talking in social media, there are still some gaps. So we've decided to engage some community health assistants, people that will move around in the village and link these pregnant women to the health facility.
Thank you so much, sir. Thank you so much for your thank you. Thank you so much.
So
thank you for a very detailed...
There's also something we did in the area of training, because we have some health training institutions which we are upgrading. The College of Nursing Loughborough, before now was School of Nursing, training only nurses. We added Department of Midwifery, got the accreditation, and upgraded it now to a HND awarding institution. We met less than 80 students in that school. But as we speak, we have more than close to 200 students there. And we've given scholarship to some, so that after their training, they will also work for the state government. It's also a way of retaining the health workers. Likewise, our College of Health Technology, Mbo. So His Excellency has done so well in the area of health sector, which I'm in charge of. And where we are now is that we are solarizing our sorry. Hello. Where we are now, we are going to electronic medical records. We want to phase out pen and papers in our health facilities. So that we started the pilot with 83 health facilities. We plan to expand it, but as it is now, that is available only in 83 out of our many health facilities, but we are using those health facilities as the pilot. Our emergency system also is very functional. His Excellency procured over 20-something ambulances, and we've now established the state medical emergency and ambulance system. But we are limiting it for road traffic accident and women with complication in pregnancy or in labor. So it has saved so many lives. If any of these people die 112, the ambulance will come go for them. And it's not only to bring them to the general hospital, but when they are taken to the hospital, their treatment for the first 24 hours, first 48 hours is free. But it's not for all emergencies. Mostly for now, we are we started with road traffic accident, snake bite, gunshot injuries, and pregnant women with a complication. We plan to extend that. So actually, the government, there is no government that will solve the problem of the health sector alone. We are also calling on well-to-do Ebonyians to bring their wealth of experience and also their resources to support the health sector of the state. We assure you that that will be just judiciously, we are going to make judicial use of that if there is any support, because we have 3 oxygen producing plants in the state, and all these things were attracted by the ministry from partners and people that are supporting. So if Ebonyians in Diaspora wants to support, even in the area of solarization of some of our health facilities, because most of our public health facilities are still dependent on public power supply, which is not reliable. So it's plan, what we put in this year's budget is how we are going to solarize most of our primary health care centers and general hospitals, so that whether there is light, public power supply or not, the system will be running. Thank you very much.
Thank you. Thank you.
Thank you.
Thank you, sir, for a very elaborate presentation. And just before we go ahead, I think the head of service joined, and if we can just introduce yourself to us, sir, and other people that have joined, please. We're trying to make this as engaging as possible. So if you can briefly just introduce yourselves to us, that would be very appreciated. The head of service, sir, if you can introduce yourself to the floor.
And to join, moderator, please, if she introduces herself, she can as well use maybe 2-3 minutes to talk to us what she is doing in her office, because I'm aware that the governor also has tremendously supported civil servants, and it's up to her to tell the whole world what the governor has done and how she has managed the office. Thank you.
That's okay. Thank you so much. Yeah, please. You're welcome, ma. Yeah, the head of service, please. You're on mute. You introduce yourself and just in a minute, please, because we are already behind schedule. You are on mute. We are not hearing you. You are on mute, ma.
Hello, good morning.
Oh, good morning, ma.
My name is Dr. Rita Mary Okoro, head of service Ebonyi State.
Nice to have you.
Very quickly, I believe I'm told I have just 3 minutes.
Yeah.
The governor, through my office, has done a lot for the civil servants. First was the implementation and payment of 75,000 Naira minimum wage to the civil and public servants in Ebonyi State. You are aware that that has, of recent, also been increased to 90,000 Naira, way above what the federal approved for payment. We also have, I think the Commissioner for Health must have intimated you on the payment of 500,000 Naira minimum for the medical doctors in the state. So I will not go into the achievements in health. We have had regular and prompt payment of salaries in the states. We've also had promotion and conversion exercises like it has never been before. There has been a lot of improvement, regular promotion and conversion exercises. Very importantly, we have had a clearing of a backlog of gratuities from 1996 till date. That is from the inception of this, of the states. And then we have also had regular payment of those pensions and gratuities. Of recent, we have had that clearing of backlog of gratuities extended to the local government service. All of the gratuities owed local government workers in the states have been paid. We're about to embark on a mop-up exercise for those who were missed either by non-attendance or inability to present their documents. So that has been done and dusted. There's been a thoughtful disbursement of CNG buses, shuttle buses, to alleviate the effect of fuel subsidy removal. As at then, our state was one of the first states that did that to alleviate transportation for civil servants in the state. I'm trying to multitask. We're actually in next. Sorry.
That's okay. That's okay. I think we've covered
that
grounds already.
Hello?
Yeah, I said I think lots of grounds.
Go ahead, head of service.
You said?
Go ahead.
You can.
All right. Just briefly, hold on. We've also had, the extension of the age retirement for teachers in the state to 60 years of age, to 60 years retirement or 40 years as the case may be. So this has done a lot for our teachers. It's quite noisy here. I'm having an issue with my system here. So besides that, we've also had what we call, one of the policies that we have had is the what we call the 24-hour service for files. We make sure that files don't stay more than 24 hours in the state, in each office, on the table of each office. Just a brief minute, I need to leave this place. It's quite noisy here. Okay, yeah, we're back, sorry. Okay, we have had the enrollment of civil and public servants of the state in Ebonyi State to the health insurance scheme, what we call the Onwa Healthcare. And there's also been the enrollment of some of our civil servants in the state scholarship scheme. A lot of them are having been given scholarships to study, to do a master's program and a PhD program outside and within the country. We have had the recruitment of personnel to civil and public servants. This has been a landmark achievement for the states. We have had a lot of retirements without recruitment in the states. So we have had about 2,000 new people have been recruited in the states, inclusive the health workers, of which I'm sure my colleague, the Commissioner for Health, have addressed before now. I don't know if you're aware that we have had appointments of permanent secretaries in every MDA have a permanent secretary currently assigned to as the chief accountant of each of these MDA. We have had what we call an award or to ensure and to encourage accountability within our civil servants. Our civil service, we have had awards given to some very well-performing civil servants, cash award and the like, given to these people. Courtesy of His Excellency, he has encouraged us to appreciate good work in the service. We have had several capacity building programs. We have in the last 8-10 years, we have had a lot of gaps in the capacity building for the civil service. So His Excellency has been very encouraging in that we have had our civil servants trained both locally and internationally in various areas. Please, I don't know if I've extended my 3 minutes, but let's make do with what I have now. Thank you very much.
Thank you so much. I will just invite other persons that have joined to please introduce themselves. And I would have wished that our commissioners that have introduced themselves were going to be available towards the ending, because I'm sure that the people on the platform will have to ask around the very points you have made on the various commissioners that have spoken to us has made points about the things that the government is doing. But yeah, if you are able to rejoin after your meeting, towards 2 p.m., people will have a lot of questions to ask, and I think that will really enrich the event today. But because we are behind time now, we want to run off. But before we can start the speeches, if I can invite all the people that have joined recently to please introduce themselves. I start with Daniel Okike-Uzo, please.
Okay, good afternoon, everyone. My name is, like you said, Daniel Okike-Uzo. I am from Onitsha in Ebonyi State, but I work with First Bank Head Office, Unit Head Corporate Loan Processing.
You're welcome,
Thank you.
sir. You're welcome, sir.
So I'm joining from my office.
Okay,
in Lagos.
You're welcome. Pass the gifts. Pass the gift, are you there? My brother that is joining with Ebonyians in Diaspora handle. If you can introduce yourself. Not hearing me. Paul, Paul.
Good morning, good afternoon, good evening. My name is Paul. I work with International Returns and Integration Assistance and EU-based organization. I'm the business development manager for the EU project in Nigeria on return and integration. Although currently I'm reaching you from Belém, Brazil, where I'm attending COP30. I will be back to Nigeria over the weekend. Nice to join you. Over.
Thank you so much. My brother Chukwuma 223. Your name is not showing here, so pardon me. Chukwuma 223 at gmail.com.
Okay, my name is Right Honorable. Okay, my name is Right Honorable Chukwuma Ogbonnaya, Honorable Commissioner for Environment.
Oh, nice to meet you, sir.
Thank you so much.
Mr. Valentine, please. He's one of those commissioners that was slated to speak to us. And I would like you to give him the time, 3-4 minutes, to introduce himself and speak to us very briefly.
Okay. Okay, sir. Please, 3 minutes. If you make it very short, because people are already running out of patience, we've delayed a lot. Thank you. Go on, please.
Okay, like I said, my name is Chukwuma Ogbonnaya. I am the Honorable Commissioner for Environment, Ebonyi State. I want to commend our governor so highly for facilitating this engagement, and our brothers who are on this platform who also probably assisted in one way or the other for us to share our thoughts in issues bordering, the state. The little I know about today's program, as I was briefed by the Diaspora focal person of the state, Right Honorable Val Okike, is about how best to harvest your wealth of exposure to better the lot of the state. Currently in the state, especially the Ministry of Environment, we've had a lot of engagement to meet up with the globally acceptable best practices in the area of contending environmental issues, such as the way we have handled our waste collection, the way we have handled our waste management, the way we have also tried to insist on doing the proper things so that our waterways don't get clogged, and then we are hit with flooding in the city. But beyond that, we are hoping that your exposure to global informations could help us leverage on some of the best, technologies, advanced technologies, to also attract sustainable investments in the city. That will also have a way of assisting the recovery of the ecosystem. Like, for instance, our source of energy in the country currently is such that gas has been our major stay, and that has continued to cause us greenhouse gas emission. And we are thinking that this engagement will expose us to few of the technologies that are already being put in use in the global sphere, such as the solar means of energy generation, the wind energy generation, and then, of course, as it concerns my ministry directly, the waste to energy kind of generation. If you saw of our engagement, but met with people whose technology has a way of capturing CO2 while burning to a certain degree of it to source energy. There will be no emission to the ecosystem. It is caged, and eventually the ash is also deployed using other measures to have organic, waste. Like when we burn these biodegradables, it could extract materials from them using gasifiers, and then make sure that there is no emission in the process. It's a technology that is already working. And so I just feel that this engagement could enable us leverage on these few possibilities, especially those of you who are not in the country where these technologies are already operational. Our worry down here is that a lot of times things we do here are more of rhetoric. People just come and tell us, speak big English for us. And at the end of the day, when it comes to practical terms of these rhetoric, then they most times run away. And so I just feel that the fact that most of you are based in a civilization, in environments where most of these technologies are operational already, it is, and I feel this is an ample opportunity for us to appeal to you to, by way of patriotism, scout out for few of these technologies that when it is deployed in the state, our state would have, been seen as one of the very few states in the sub-Saharan region, using the globally acceptable best means and practices to advance the cause of our environment. Thank you.
Thank you so much. Thank you. Thank you so much. And we'll just carry on and, as I said, introduce the people that are in the room, and then we'll carry on with the presentations for today. So Kingsley Onyamagre, if you tell us your name, where you are joining, where you are from in the Ebonyi State, and what you do.
Thank you. Good afternoon, everyone. Am I audible, please?
Yes.
Okay. So I'm Kingsley Onyamagre. I'm from Afiko in Ebonyi State local government. Currently, I'm an emergency medicine physician working at the University College Hospital, Ibadan. I'm also a public health specialist with medicine, health policy and management. Hello?
You're welcome. We can hear you. Yes, we can hear you.
Thank you very much. Thank you.
Thank you so much. Thank you. Edwin Okoro, please.
Yes, good afternoon, everyone.
Good afternoon.
Okoro Edwin Ogbonnaya from Afiko local government, Oziza precisely. So I'm a student of ACE Fuels, that is African Center of Excellence in Future Energies and Electrochemical Systems, running my MSc program there. So thank you for this opportunity to join this program.
Thank you so much, bro. Trying to figure out Oshola Innocent Ewoshe.
Hello, Doc.
Yes, please.
I was wondering, since some of them are still here, whether we can proceed with presentation and then they can introduce themselves during open conversation, so that the commissioners who are busy can listen to some of the presentations and then go.
Fair enough. Fair enough. The next thing that would have briefly shouted up, but is kind of been eating with time, was to talk about the Ebonyi 2050 strategic foresight, which is some sort of idea of the kind of Ebonyi state that we expect to see in 25 years' time. We believe that it's important that we start talking about it now. And by talking about it and bringing people that know a lot, to help us, guide us, going beyond election cycles, for instance, going beyond, what the current government is, and looking more forward to think about the sort of future Ebonyi state in 25 years' time, when the current administrations would have come and gone, and the people that will come after them would have probably come and gone. What kind of Ebonyi state do we all want, and how can we play a big role in bringing about that sort of future. We strongly hope that by bringing Ebonyi State people to talk about these things, we can together, work out together. Hello, please. If you are not speaking, if you can put yourself on mute.
I will be muting them. Yeah.
Right. So, so if we can bring Ebonyi State people, the ones at home, the ones overseas, to talk about some of these issues, then we can begin to bring ideas that can support and inform the actions of government. This is how we'll all get there. Obviously, we have different opinions and perspectives about different things, but this conference going forward is going to be a platform for Ebonyi State people to essentially come together, rub minds together, share ideas, not just to support the current government, but like looking forward into the future and helping build the sort of future Ebonyi State that we want to see. So today, our discussion is going to be centered around three things initially: energy access, health, primary health, and basic education. The invited guest for energy access had just dropped off. Okay, so we are going to then focus on primary healthcare and basic education. So primary healthcare, we have Dr. Laz Ude Eze, who I presume a lot of people on this platform knows, to talk to us about primary healthcare. Dr. Laz is a medical doctor, but he's doing a lot of work on health advocacy, not just in Ebonyi State, but across Nigeria and beyond. We believe that he has a lot of experience, and it even makes it interesting because he's an Ebonyi man, and not just an Ebonyi man, he's an Ebonyi homeboy, literally, because he grew up at home and he experienced some of these challenges firsthand growing up. And we believe that with this type of background and experience, he can help us drive a conversation on how we can move forward with primary healthcare delivery across Ebonyi State. Then after that, we have Dr. Chukwuma talk to us about education. Dr. Chukwuma is an engineer by training and currently working in the UK as a lecturer at the university. He's the associate dean at Loughborough University in the UK. But outside that, Chukwuma has been doing a lot of work that I know of in education. Chukwuma started off an organization with his community people, the Onitsha Education Foundation, where they did a lot of groundwork, a lot of research, around how they can maximize educational opportunities for people in his community. What I also used to have in mind myself is that resources are limited. And the big question is, of course, if we had endless resources, if we had endless money, it is very easy to say, build this, build that, build this, build that. So the key question that I'm looking forward that our, speakers will help us address is, how can we use from the little resources that we have, how can we get more mileage, get more out of it in terms of healthcare delivery and in terms of basic education? All right. At the end of at the end of the two speeches, we'll have a time to ask them questions, to talk about some of the points that may have been raised by the honorable commissioners, and then we can, sum this up and prepare an action document that will be shared with the government and shared with all of us here, and that can help take the conversation forward. Hopefully, some of the things that we'll draw out of this conference, we can get to the point where the government will hopefully begin to implement some of them. So once again, thank you so much, and thank you so much for making time to join this meeting. And on that note, I want to call on Dr. Laz Ude Eze to kick off the presentation for today. Thank you so much.
Dr. Laz, are you there?
Yeah, thank you very much. Can you hear me?
We can hear you.
Good afternoon, everyone. Do I have 20 minutes? That's what is on the agenda, or is it less? So that I know how best I manage my time. Okay, I'm not sure you could hear me, but Your Excellency, the Governor, ably represented, the senior officials of Ebonyi State Government, the head of service, the commissioners here present, officials of the Ebonyi in Diaspora organization, and fellow Ebonyians. Good afternoon, everyone. I'm delighted with the opportunity to share my thoughts during this conference. Thank you, Dr. Enyoko and Dr. Chukwuma and others who played critical role, the Commissioner for Special Duties and Diaspora Focal Point for the state, for making this possible and starting this conversation about Ebonyi 2050. As been mentioned, I'll be speaking on primary health care. My background in almost 2 decades is in health. I'm a public health physician and also a sustainable development consultant. My education had taken me from Okbose in Ebonyi, where I come from, to Afikpo, where I had my secondary education, to the University of Ibadan, where I had my medical school training, to the University of Kentucky in the US, where I had my master's in public health, and recently to Trinity College, Dublin in Ireland, where I had additional trainings in brain health. I've also worked in these places as well as Togo. Over the past decade, my work has been largely around health system strengthening here in Nigeria, even though periodically we get to do some work outside the country. And working in health system strengthening brought me closer to understanding primary health care, the practical aspects of it, and not just what we learned in medical school. I've supported a lot of states across the country, and I've almost been to all the states in the country doing this work. In Ebonyi State, I've followed very closely the developments in the health sector across different administrations. I became more active following that during the administration of His Excellency Governor Martin Zelechi, and I used to disturb the then Commissioner for Health, Dr. Can't remember his name now. Then later the administration of Convener, and recently, I know I had a chat with the current Commissioner for Health not too long ago, where I was drawing his attention to some things in my primary health care. So my presentation will be largely very practical. There's a slide I shared. I don't know if it could be projected. If it can, that's very fine. But if it can't, that's also fine. It was slides I prepared last year that I shared with one of us. I was in Ireland at that period, and that was about a year of the current administration. So one of the Ebonyians in Diaspora said he wanted to engage His Excellency and discuss on developmental issues and sought my opinion on health. And I prepared about 13 slides, made certain recommendations, for possible discussion with the state to implement. And listening to the Commissioner for Health, I'm happy that a number of the recommendations I made in that document is already being implemented. I can't take credit for that. I don't have monopoly of ideas or knowledge on what to do, but I'm just happy to see that there's some progress being made. I would share my thoughts within the context of the 6 building blocks of the health system. And this is also given that we're having a conversation around a 25 years development plan 2050. Well, we know that to count 25 years, you have to first of all count 1 year, 2 years, 5 years, 10 years, as the case may be. So some of those first steps has to be taken now during the current administration, while those that will be coming after, will build on that. So having said that, there are 6 building blocks of the health system. And number one that is most important to me, if anyone could be said to be most important, is the human resource for health, which the commissioner has said a lot about what they've done about it. So this building blocks is like if you have a building and maybe pillars, if you like, let's say each of them is a pillar or is a leg, and if any one of them is not strong, it will make the building to be shaky. So for our primary health system to work effectively, it has to stand very well on these blocks. So, but before I go into the details of these building blocks, I want to refresh our minds for some that know the definition of primary health care, because a lot of times we tend to confuse primary health care and primary health care system or primary health care center. Primary health care and primary health care center. So primary health care was...
Dr. Laz, sorry for interrupting you. Can you see your document on screen? Can you see?
I'm afraid I can't see it. No, I can't see it. Okay, it flashed now and disappeared. Okay. Unfortunately, I'm unable to see it, but if it's going to cause delay, no problem.
Okay.
Okay, I think I can see it now. Okay, I can see it now. You could move to the next slide. This is the cover. I was trying to define the primary health care according to the Alma Ata Declaration of 1978, where all countries of the world came together to look at the global health system and how best to make health more accessible to the people. And primary health care was defined as essential care based on practical, scientifically sound, and socially acceptable methods and technology that is universally accessible to individuals and families in the community and delivered through full community participation that is affordable, and also a central function of the country's health system and community's overall social and economic development. So it mentions some very key words: practical, scientifically sound, socially acceptable methods and technology. And it also hammers on community participation, affordability, and technology that the people can afford to maintain at every point of their development. So the key principles from this definition has to do with access, and access has to do with geographical access, which means it's close to the people, and access also has to do with financial access, which is what the health insurance is trying to solve. The Basic Healthcare Provision Fund from the federal government and the expansion of health insurance that the commissioner had talked about to all civil servants in the state. Then participation is also another key principle. Are the people participating in primary health care in Ebonyi? Do they participate as individuals? Maybe yes, to some extent, but as a community participation is one of the key principles. So the commissioner talked about a whole lot that is being done and a whole lot that has been done in the health sector. But to what extent does the communities in Ebonyi State know about this, and to what extent were they involved in the implementation? Integration is another key component. Equity is just social justice, everybody being able to access these services. So having spoken about this primary health care, then the 6 building blocks of the health system comes to mind because all of them are applicable. I'll quickly go through those building blocks. I'd mention human resource for health, which is the health workers. The next is health information, health management information systems, or health information system speaks to data and the medical records and management of the data. Then there is the medical products, vaccines, and technologies, which about drugs, reagents, all the products, equipment that are being used, speaks to that. There's health systems financing. Health financing, how do you pay for health? Who pays for what? Who hires people? Who pays for services? Health insurance comes under health financing. There's also leadership and governance. Leadership and governance operates at various levels. According to the National Health Act, Section 2, that define the Nigerian health system, it mentioned different categories from the Federal Ministry of Health to the State Ministry of Health to the local government health authorities, but it also went beyond that to the World Development Committees at the World at the world level, political world level, or World Health Committees. He didn't stop there. He went to having community health committees or village health committees or village development committees, if you like. So what we have in Ebonyi that is operational is up to the world level. I'm not aware if there are community health committees across the state. I know there might be pockets of community or village health committees here and there. And in 2021, I had a project that I piloted in Ebonyi, using the media-inspired community action for health strategy, where we supported we facilitated the establishment of some village health committees in Ahozara and Afikpo. Some of them are still viable, but some, are no longer viable. So leadership and governance brings that into consideration. And I think number 6 is service delivery. So I mentioned health workforce, number 1, information system as 2, medical products, vaccine and technologies as 3, health financing as 4, leadership and governance as 5, and health service delivery as 6. So those 5 coming together, contribute to the quality of services that we get in the facility. So many of the times what we see is the service delivery. You go to the health facility, how you are attended to, how did they address you, did they respond to you on time, did they give you the appropriate medications, they talk to you with respect, so the things that determine that there's a whole lot that go behind the scene to make this possible, and the Commissioner for Health presentations captures some of them. So to be able to plan on where we need to be, we need to know where we are or where we used to be in the past, where we are currently, and where we want to get to. And within the context of these health systems, I know the slides were specific to some of the recommendations in the presentation I shared last year. So I will finish up with it, in the course of this presentation, because they are very direct. Certain work had already been started, but some more work will still be done. So this systems approach will give us a full picture and we'll be able to connect the dots, because one interesting thing about health is that it's one sector that operates 24/7, in addition to the security sector. So government takes security very seriously, and health is also a security issue, in my view, and there's a health security component. So it's one sector that operates 24/7. The education, schools might close and people might rest and they resume and come back. Any other sector could be periodic, but health is 24/7. So it's a sector that anytime anything can happen, and if the system is not resilient, is not strong enough to respond to it, that's where we could start having significant issues. So taking it for human resource for health in Ebonyi. Ebonyi was created in 1996, as we know, from two states, Abia and Enugu then, and we inherited the health workers from both states. So, but from this creation of the states up till 2023, I was not aware that there was any major, and I use the word major, recruitment in the health sector in the state. There could be pockets of taking in one person, two persons, from time to time. But it was in 2023, within the first few months of the current administration, that they hired over 30 medical doctors, pharmacists, and medical laboratory scientists. Before them, for those who have followed my work, I lead the Make Our House to Work campaign, which we started as a national movement in 2020. And I was one of those voices that used Ebonyi as an example of a state that had about 6 medical doctors in its employment. And not many people could believe it, as at then it was only one pharmacist under the employment of Ebonyi State Ministry of Health, who was also the director of pharmaceutical services. So there was no one for him to direct because he was the only pharmacist under the employment. So those data sounded unbelievable because some persons said it was politics and stuff. But when the current administration came in and repeated those data as a reason to prioritize hiring new health workers, some were shocked and they say, "Oh, we thought you were just playing politics. We didn't know that what you were saying was a fact." So thankfully those recruitments were made within the first few months of the administration, and it was quite exciting to see that. So now with those people, that's at least there are 13 general hospitals in Ebonyi State, 1 per LGA. So if you have over 30, it means we should have maybe an average of 3 of these people working in each of the general hospital, or at least minimum of 2, assuming some of them are working in the ministry. So each general hospital should have a minimum of 2. The question we need to ask ourselves are people on this call, whether you are in Ebonyi or you are outside Ebonyi, you need to check within your state, your general hospital in your community or in your LGA, do you have at least 2 medical doctors working there full time? And if they've been posted to work there full time, are they actually working? In my LGA, the Okwosi General Hospital, it works in the day, it doesn't work at night. And I made a video not too long ago, which, it got to the Commissioner for Health as well, and I got the response he made to it and the response he got back, though not directly, but I monitored some of those stuff, with at least 2 medical doctors, the general hospital should be able to work 24/7. With the incentives that the state had given, the cars, the fuel allowance, the rural posting allowance, the increase in salary to minimum of 500K, it used to be 100 and something thousand, or perhaps about 200K. So that increase is more than 100% increase. So we need to demand value for this investment, because if the state has hired people, increased their pay, trying to create a better environment for them to do their job, the question should be, are Ebonyi people benefit from it. And this is an area the commissioner need to look at. That it's good to realize some of these investments that's been made, but we also have to supervise, monitor and supervise and follow through to ensure that the people are getting these benefits, that they are seeing the difference, so that it's not the same way the hospital was functioning, say 5 years ago. You go there now, it's almost the same thing, despite these huge investments. So that speaks to accountability on part of human resource for health. If I was speaking 5 years ago, I would have been hammering more on hiring doctors, hiring pharmacists and stuff. Now, some have been hired. We may argue that, oh, is it enough? But before we even begin to see whether it's enough or not, we need to see that those that have been hired are doing their job optimally as it should. So when they are performing their responsibilities, we'll now be able to say, okay, maybe they could need more people. But right now, all our general hospitals, and I say that with every sense of responsibility in Ebonyi, is performing far below the capacity should be performing. And this is something to be looked at. Then what about other categories of health workers? Nurses. I'm not sure we've hired nurses in the recent past. As at 2019, like 2/3 of Ebonyi nurses had retired. 2/3 of those who were in the employment as at year 2000 had retired as at 2019. So I don't know if there's been a major recruitment of nurses on that. Primary healthcare, yes, in the last 1 year or thereabouts, there's been recruitment of community health extension workers, CHOOS, under the Ebonyi Impact project. It's a World Bank supported project. And from information I have, these people that have been recruited, their contract is ending this December. So I would like to know from the Commissioner for Health if is there a plan to retain them, because they are more like contract staff hired through the project as skilled bed attendants, about two per health facility, across the state. So there might be need to normalize the appointments and retain them, so that they won't have to leave our health system, as it was done during the MSS, Midwife Service Scheme, where midwives were hired, and when federal government stopped paying within 2 years, the states didn't take over, and we lost most of them, and they are largely out of the country now. So I've talked a lot health workforce. So we need to ramp up, get more people in primary health care to deliver services. There is a lot of gap in terms of human resource. I'm carrying out a study in Ohozara and visited all the primary healthcare facilities, both public and private. It's a dementia study, which the commissioner is also aware of, and the primary healthcare agency. And one could see that we have significant gap. Every primary healthcare facility, by standards, the World Health Systems policy requires at least 16 skilled health workers, if we are to go by the books. That's for the health centers that operates 24/7. But there are 3 categories of primary health care. There is the primary health, there's the health post, which is just a small building that's maybe 1 or 2 rooms with maybe 2 staff and some support staff, maximum of 5 staff. There's the health clinic. Health post can operate for maybe 6 hours or thereabouts in the morning. It's quite small and serves like 500 people or less. But health clinic serves up to 2,000 people. It can operate maybe up to 8 to 10 hours, depending on the needs of the community, and should have at least 6 skilled health workers. And we now have the PHC, the Primary Healthcare Center, the bigger one they are prioritizing at least make 1 or 2 functional per ward. The PHC is the one that operates 24/7, and the people working there should be running shifts. You could have those that will work in the morning, others will work at night. They will have a residential building, there where they live, so that at any time that anybody goes there, you see people that will attend to you. And not only having the nurses, choose midwives, but they also have even accounting officer, security personnel, also have pharmacy technician, lab technician, medical record officers, the full complement that some will work in the morning, some will work at night. There is no single health facility, primary health facility, or primary health care center in Ebonyi State that comes anything close to having this. We may not have them overnight, but we need to know that this is what we need to have. And it's a work in progress. This is where we are now. Say in the next 5 years, this is how we move it up. In the next 10 years, this is how we move it up. And it will be based on the need, So to determine this, we need to do a needs assessment. From needs assessments, you'll now be able to develop a strategic plan. If we're saying health, primary health care, or our overall health sector strategic plan, development plan for 2050, we'll be making it not based on what we think or using one formula across the entire state. Local government by local government, community by community, their needs might be a bit different. There are locations you might go to is more rural, based on the environment. There could be more snake bites, there could be more issues there. You go to another environment, their needs are different. So when we carry out a comprehensive needs assessment for our health sector, beginning with primary health care, why is there emphasis on primary health care? Primary health care can comfortably take care of over 80% of our healthcare needs if they are fully functional. And when it is working, then the tertiary health facilities like the teaching FETA or the Norfolk obstetric or DUFUT, those ones will work better. If you go to FETA now, the Federal Teaching Hospital in Abakaliki, it's usually like a market square. Because there is very large cluster of people, human beings all over the place. Cough and catarrh, we go there. Uncomplicated malaria, we go there. No, teaching hospital is not built for those kind of minor cases. If we have fully functional primary healthcare facilities, majority of the people we go there, there's no point somebody from Onitsha, for example, going to Abakaliki for healthcare, for some basic healthcare. When there is a general hospital in Onitsha, for example, when there is a Eliwofu General Hospital, and when there's a general hospital in Ezambo. So when they are fully functional, they handle many of these cases. The health centers will make referrals to them. It's only highly complicated cases that can be referred from the general hospitals to the teaching hospital. And you go to teaching hospital, it's not a place you have thousands of patients. No, you have few people. Highly complicated cases, people that need specialized care, people that need full attention. You could have 5 doctors who will be on the case of one patient who is probably in intensive care unit or within the ward. This one comes, does their bit, they have a meeting, they discuss, and will be able to get that quality of care. But what we currently have is, because our primary care is not fully functional, our secondary, which is the general hospitals, are not fully functional, there's so much pressure in the teaching hospital. People are not being referred. People just go there directly and those who can't afford to go there, they usually try alternatives or, resort to prayers to get help. So when we make the primary care work, it reduces the pressure on the tertiary care. So those with kidney disease, those with heart failures, those with diabetes, complications, and all those kind of situations, they will get the quality of care they deserve. Okay. I don't know how many minutes I have left, because when I talk health, I could talk forever. So, but I guess I should be rounding up within the next, say, 5 minutes, and we open up for further conversation. So, on human resources, can't overemphasize. Then, leadership and governance. A lot of times when we talk leadership and governance generally, to an average Nigerian, what comes to mind is government, 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 which is fine. Government provides overall leadership and direction, but when it comes to healthcare, government still does that, but there's also leadership and governance at the community level. And that for me is a major gap in primary healthcare. Community participation, community ownership is an integral component, is in the DNA of primary healthcare. Without it, no matter what the government does, the people cannot fully gain the benefits of primary healthcare. So, but we need the government to make this happen. It's an aspect that doesn't cost money. It's not like procuring, buying equipment, commissioning things, and that's perhaps probably why it doesn't appear to get much attention. Every village have leadership structure, or every community or autonomous community. They have the Eze, they have the development unions, they have village chairmen and all of that. At every of such level that you have leadership, there should be a health committee. And they have clearly defined responsibilities. The World Health Systems, WARD Health System, is a national document, a policy document that's been there for years. We can domesticate and have our own for Ebonyi, which I'm sure we don't have any for now. So, but it's something that we can develop, because all these things begins with having a policy. So have that, ensure that every community has a health committee. The commissioner mentioned about procurement of equipment. There was something that happened in December 2020. The Ebonyi State government procured equipment for some selected general hospitals, including the Okposi General Hospital. And we had a help make our hospital work campaign team within our community. So when they went, I got the information through a government official who have been disturbing. What are you people doing for health? Our hospital is not working. I now say, oh, there's equipment that have been procured on Okposi, one in Onweke and all of that. So there are about 6 of them across the state that got that at that moment. And our team on the community went on ground and helped to take stock of those equipment that were supplied, beds, mattress, chairs, and some of those things. So, and we shared it within the community WhatsApp group. 8 months later, I went home and I took somebody to the general hospital, an elderly woman who had a fall. And she was to be admitted. Went to the clinic, he said, okay, take her to the ward. And the ward was scanty, wretched beds, riffraff, so untidy. And I asked questions. There were new beds and mattresses and everything procured less than a year ago. Where are they? And they were all packed in a store. So I raised some kind of questions. The Commissioner for Health was involved. The following day, Commissioner for Health had to come there. They packed it in a store and not being used for the people. So these are some of the things that keep happening when the community is not involved. So the commissioner cannot be everywhere. The directors, everybody, they can't be everywhere at the same time. So, but when the government is doing this stuff and they involve the community, before taking this equipment, the stakeholders in the community know that, oh, this general hospital, this is what it's getting. This health center, this is the equipment that is coming there. And the list is there. Now with technology, people share it in their WhatsApp groups. If they procure the sphygmomanometer for a health center and someone goes there next week and they can't check the blood pressure because there's no sphygmomanometer, they'll begin to call their honorable members, begin to call people, what's happening? This thing that the state has supplied, we are not seeing it. Through that, people will be held accountable. They will not take it to their, either sell it, because what happens after a while, some of those things will start missing. Some could be sold, some could be diverted to private hospitals. So while the government is still singing and celebrating, putting pictures of achievements, of equipment procured, the people are not getting the impact, they are not getting the value. So I think this is the missing link that we need to. We know that we don't have the money to solve all the problems, but for the one we are investing, we need to follow through to ensure that ordinary Ebonyians are getting value for money. And one of those ways is to activate the community governance structures, the health committees, and they will be reporting to their PG. And if there is any problem they have, they follow certain channels to report to the appropriate government institutions, whether at the local level or at the state level. And one of the things it could also help to do is to harness resources when a roof is leaking. Instead of waiting for the entire roof and ceilings to damage and it becomes a major contract or project, the community will get to know the roof is leaking and they'll call somebody that will climb and fix it, with less than 5,000 naira. Instead of everybody feeling it doesn't concern them, it blows off, the health center stops working for years, So that's the relevance of community participation through community governance structures or village health committees. So under leadership and governance, to complement what the state is doing and to make people get more value for these investments going forward, not just for now, but also in the future, getting feedback that the state needs in its own planning, because a lot of times we plan without involving the people. So there's the demand side, there's the supply side. The demand side is the people who are benefiting from these services. The supply side is the health facilities, including the government that makes these decisions. I'm happy to know that under health information system that we are migrating to electronic medical records. There is a whole lot that is required if that must work. I'll be happy to know that the health facilities that has this, especially within our house and Afipo, because anytime I'm in Ebonyi, I visit health facilities, I talk to health workers, across board, and I get first-hand information, to know where they need help. The ones that could be handled at community level is done. The one that requires the state, we get it done. To round up, Ebonyi has made some progress, but we have so much to do on health. And I also employ the government to have the entire state in the picture, because the emergency medical stuff, which I'm happy it has started, is mainly accessible in Abakaliki at the moment. I know you may not just start the whole state at the same time. You may need to pilot it, then make some corrections before you scale up to the whole state. But the people would need to be aware that we have this. I thought some people in Abakaliki and they were not even aware of that. So let there be regular jingles, for public awareness on various platforms, both the government and the private radio and TV stations in the state, and flyers on social media that people can circulate so that the people will know about some of these initiatives. So the environmental management, which is a primary healthcare issue, the EPSEPA, Ebonyi State Environmental Protection Agency, since the creation of the state, has been mainly operating within Abakaliki, capital territory. So waste management, which is a primary healthcare responsibility as well, by the constitution, is under the local government system. So it would be great if EPSEPA works with the local government people to ensure that we manage our waste properly, because a lot of diseases that our people get to suffer is things that are picked from unhealthy environments. Open defecation is very widespread. We did a survey of 24 government-owned primary schools in Loughborough recently, and only 2 out of 24 has functional toilets. And out of those 2, I went to one recently, and they even said their toilet is no longer working. So just one. So imagine the students having to go into the bush, open defecation, with fecal-oral transmission of diseases. So a lot of these things are primary health issues, health education, waste management, environmental management, and stuff, and not all of them are within this Ministry of Health. So some are within Ministry of Environment, some are even within Ministry of Works when it comes to access to health facilities. Are the roads good enough? Are they motorable and stuff? So in summary, I want us to do needs assessment, 1, 2, develop a comprehensive Ebonyi State strategic health development plan that will now itemize the issues short term, medium term, long term. Do a costing of what it is going to take, to do this. And of course, the responsibilities of various stakeholders, the community level, the local government level, the state level, diaspora, international partners, so that for me is a major starting point. Then, and the monitoring plan, monitoring and evaluation plan, because when you don't plan, you just be throwing resources. We are very good in monitoring inputs in Nigeria. We voted 3 trillion, 5 billion in doing this, but we are not so good in monitoring the impact. After spending 5 billion, what's the results? A lot of times we don't look at that. So to get maximum value for money, and also political capital, because a lot of times when we talk about, when senior government officials talk about these achievements, the people can't relate. They can't quite relate to it, not because they didn't do what they said they did, but it hasn't translated to results that the people can feel and even talk about it by themselves. So this is an area that the government needs to look at. The primary healthcare intervention is ongoing. The one in my ward is being rebuilt through the impact project, but the quality of work was terrible. It was quite terrible. And the World Development Committee, which I'm a member, wrote a letter to make complaints like a month ago. Until now, there's not been any action to address some of those things, because how would a builder be building and the parapet had fallen 3 times of a residential building for health workers, in a primary health facility, and doing some louvering, a lot of things that have been itemized, which have drawn the attention of the Honorable Commissioner for Health too. So we need to do a lot more monitoring and supervision. If we are building, let the community be aware, because my community was not aware. I just saw a new building and I started asking questions, and they say, oh, it's impact project. But our people were not aware. That's why they couldn't identify maybe builders who will be doing local supervision. Because if you expect someone to come from Abakaliki to supervise, it's expensive. They may not have the time to be everywhere. But if the communities are aware, they have builders, they have people that understand, and they'll be doing monitoring. We don't even have a BOQ to know what that builder was expected to do. And he was being arrogant, even when corrections were being made. So to make our state work, to make everything work, we just have to go about it in a way that every resource counts. So thank you very much for this opportunity. I'll be happy to respond to questions and share. Also getting feedback from many of you. Thank you and God bless.
Thank you so much for a very fantastic presentation. I think for me, part of the very key thing that's come across very strongly to me is having committees at the ward level, to health committees to look after some of these projects and developments, and several other things about communication, about having some sort of plan, a very clear action plan on how some of this will be delivered. We are going to come back to questions. We'll go straight to the second presentation.
Please, hello. Everybody, I need to respond to some of these questions because of other engagement. Am I permitted to do so?
Yeah, but if you can keep it brief, please. If you can,
I'll make it
great.
Just very brief. So thank you, Dr. Ude Eze, for the detailed presentation and analysis. You've done well, but What I want to let you know is that most of the things we are already on ground. We are talking about involving the community. You are even part of, you are even a health committee member in your area. So we have that. There is no place we have primary health care, but we don't have the ward committee that looks at what is happening in those facilities and report to the appropriate quarter. So community participation, as you rightly said, is one of the key points, one of the facts, and one of the things that will give result in the primary health care, and that the government has been doing. So then, secondly, I want to let you know that some of the issues you are raising, either that you are not getting your information from the right source, or that maybe you are talking based on outdated information. So I don't know why you say that there's no nurses employment or something like that, but you only know about them. Those things were done at the same time. And the number of nurses employed were more than the doctors. So what? No, let me talk. Just give me 1 minute. I'm rounding up. So my office is open.
Move on, sir.
No. Let me finish. You're giving me the permission. My office is open 24/7. If you need any information concerning the health sector, you should get it directly from the office of the commissioner. I am a medical practitioner of many years experience, and I'm a consultant of physician and gynecologist. I've worked in different places. I cannot be deceiving the public. So any information you want to get it directly from my office, and not that you call one health worker in your place or something like that. Mark you, I said the revitalization we've done, we've selected one health facilities per ward. So you may be talking with somebody that is not in a selected facility. I did not say that we've overhauled all the health facilities. I said one per INEC recognized political work. So my office is always open for information concerning government projects in the health sector. Then other issues, just in summary way, that's what I've said. Get the direct information from my office. My officer is available to give you a valid information. Thank you very much. For want of time, I ask for permission to do other things in preparation for the experiment. Thank you.
Thank you so much. So we'll come back to all those points. The only comment I will make is that maybe the commissioner's office should probably maintain some other channels, because the problem with this, if you need any information, come to the office of the commissioner. There is a lot of problems with that, and I hope we can lend our voices and recommend on, improving information access, and that will be very good even for the government and for the people. So information access is very important.
I totally agree with you. Once you confirm anything from the right source, you can post it. Like the emergency services are telling me, some people in Abakaliki urban is not aware of it. If you discover such and you confirm that the ministry is doing this, you are free to post the commissioner and post it, such that people that are in your own page can know of it. As far as you confirm that you are offering this service from the right source, you are free to also escalate it so that people will get to know about it. And rightly, as you said, apart from the capital city, we still have some local governments, Uzo or Huku, where we are now. And just as you said, it does not involve every local government. But for those local governments we are in now, if anybody says he does not know the information, I've said it. So if you put me and post it up, it's still a way of making the information available to people. And another thing is the issue of identifying all the problems. I was also expecting that maybe after identifying some of these, that maybe your association or organization will help to push one.
Yeah, it dropped off. I know everybody have got a lot to say, But please just hold on with that. Please write it down. We are going to come back and we're going to have enough time to discuss all the points. Please allow me to introduce this next speaker. We are going to come back to the questions, please, because this is already past 12. Okay, please, Dr. Chukwuma Ogbonnaya, if we can go on with education, please, Kingsley. Laz, I know you have Chigozie or Moha. I know you all have a lot of comments to make on this. Please just hold on with that. Chukwuma will finish, and then we'll enter into the open floor session where all of us is going to have a time to lend their voices to the various points. Thank you so much. Chukwuma, please. Thank you. Chukwuma, are you there?
Hello, can you see my slide?
Yes, we can see your slide. Thank you.
Okay. Thank you, moderator. I appreciate the opportunity to make this brief presentation. I am currently lecturing at Loughborough University, and I'm a Deputy Associate Dean of EDI, Equity, Diversity and Inclusion at Wolfson School. I'm also a chair of the Rich Staff Network. I'm the chairman of Board of Trustee on the Education Foundation. So most of the data I'm going to use will be what I sourced locally. But I just want to also say that upfront, that my calculation and estimations are based on estimates and based on the data I sourced. And also, I also want to say upfront that this is not to criticize government. Coincidentally, I'm almost very, very happy with what the government have done in education sector. So don't take it that this is a criticism. This is an academic exercise. And at times when people say, you are being too academic, I say, yes, we need to be too academic to do the intellectual part first, and then we can do to the practical side. I hope with this, I will run through my presentation because we've spent time. So first, I want to thank the governor for establishing Ebonyians in Diaspora focal point officer desk. This is the first time a government is saying we have people from Ebonyi State living in diaspora and we want to be interacting with them. And there is no other better proof that the governor, even if he's not here, that he's interested. Even when they have a budget session today, he still say, make our time and attend. We have the Commissioner for Education, Commissioner for Health, Environment, Commissioner for Special Duty, and Head of Service. He say, interact with Ebonyi. So we take this seriously, and we thank the governor for creating this opportunity. I also want to thank the Honorable Commissioner for Special Duties and State Diaspora Focal Point Officer, Right Honorable Barrister Valentine Okike-Uzo, for the hard work he's putting into this desk. Okay, this is something handed to him without, because it's new, there is no rule books, there are no guidelines. So he is creating, supporting this ecosystem to evolve in a way that it will benefit Ebonyi State indigenes overseas, Ebonyi State indigenes within the state, and the state government, because the conversations we are going to have here, we can pick it, and the government can pick it and do something with it. I also want to commend the Ebonyians in Diaspora. I know many of them are here online for supporting this initiative. I am working at Wolfson School, and a lot of people don't know about Loughborough University. It's actually one of the top 10 universities in the UK. And Loughborough University is #1 in sports. And I know that the state government, they want to start, I learned they want to start a university focusing on sports. I think that if they're interested in working with the university that is #1 in the world, I can take you by hand and lead you to the Vice Chancellor's office. Okay, and that partnership can be created. I want to focus on the core principles or 5 core standards for basic education. Okay, and I want to first of all start by saying that education across the globe is seen as a fundamental human right, and that is derived from the Universal Declaration of Human Rights, Article 26, and the Convention Against Discrimination in Education. So every child, automatically, regardless of the privilege of the parents, should have access to education. And that is the first principle. So another one is making the education inclusive, which means that every child have equitable access to education. And then that the state promotes lifelong learning so that people can continue to learn even after school. So we can also see that the education is also linked to gender equality. Okay, and also the outcomes of education is very, very important, because education is one of those benefits that a citizen can get that can support the citizen in working and also in life. Dr. Laz just did an excellent work in public health, talking about basic health system, and you may agree with me that those who are educated will be better off in terms of how they take care of their health. It's also it may also connected to how they take care of their finance, even how they do their businesses or how they conduct themselves in the society. So education is a public good. So if we look at the international standard classification of education, we can see that education is classified to level 1, the early childhood, which is a kindergarten or nursery. We have level 0 is kindergarten, level 1 is primary education, level 2 is lower secondary school. Of course, we then have senior secondary school and so forth. What is the implication of quality in terms of education? There are 3 domains I want us to focus on, and that is where I will also be recommending that the policy of the state should focus on. The first one is the people, the students, the pupils. So education should develop knowledge and skills for life and work. So the type of education that we can be promoting in Ebonyi State is such that develop not just knowledge, but skills for life. And the second one is the curriculum, which is what are we teaching them? What is the content of what we teach them? So it should be able to help them to promote peace, human rights, sustainability. And the other one is the teacher domain. So the teacher domain, we will be focusing on the teachers being qualified and supported. And I must say at this point that the Honorable Commissioner for Education, I was excited when he was mentioning the efforts they are making in the state, and it aligns with what I'm saying. That
Off floor solar.
sorry.
On that. Put your slide.
Sorry. So he mentioned about recruiting 2,000 teachers, which falls within that domain. So the third one is the schools. How safe, inclusive, and non-discriminatory are our schools? So, like I said, if you look at the national policy on education, that is Nigeria's national policy of education, you can see that the basic education is very central, which means that if a child gets good primary, junior secondary, and senior secondary education, that child will then have a better future. Okay, but without it, that child may be struggling. So if we then focus more effort on that foundational aspect of gaining education or access to education, it then means that it's going to amplify other efforts the government is going to make. So I'm always shocked that the Nigerian Constitution encourages the state, as a matter of constitutional rights, to develop and fund education. However, at the end of the day, they say it's not justiciable, which means that the government cannot really be held accountable. And of course, when we say that we have over 10 million out of school children across Nigeria, it sounds unbelievable. Because, for instance, in the UK, you can see that the UK government, even if it is a child, they can pay for a child to be taught. So a situation where we have over 10 million in Nigeria, you would imagine why the society is not stable, because education is not being taken seriously across Nigeria, not just in a particular state. So Nigeria, we have laws, but we are talking about practical strategy and policies to operationalize these policies. Onitsha Education Foundation has been there. I know Dr. Eni Oko mentioned it. Onitsha Education Foundation started 2020. We've been there. When the governor resumed office in 2023, we did an analysis. So we took the people charter of need and then analyzed all the sectors. Education, we noticed that the government, they have education, health, agriculture, doing business, all those domains. We looked at them. We then took the 17 Sustainable Development Goals and we said, okay, these policies, how do they map on the best framework we can use to develop any country in the world today, or develop any state in the world today? So after mapping it, we reached a conclusion that those two documents matched, which means that if the governor or the government as an institution, if they are able to pursue the content of the People's Charter of Need, that they are indirectly working on the major domains of United Nations Sustainable Development Goals, which is very, very laudable. Another observation we made was that the government prioritized education. If you look at the first sector, you see that the sector had the highest items. Okay, because this is based on the items on the People Charter of Need. Of course, if you want to read the full report of this, please feel free to send me an email or a chat, and I will forward the comprehensive report to you. So, and of course, we could see that the government is also walking the talk, not just talking the talk. I'm not a politician. I'm not working for government. I'm just saying this is the data we got, and these are the data. So, for instance, the scholarship that the commissioner talked about falls under education. The building of infrastructure falls under education. So these are good indication that the government is thinking about education the way they should think about it. However, I believe that it's not enough. And following the analysis of the data we collected recently, we also think that more should be done to emphasize the need to develop leveraging the power of education. Because education is an equalizer. Education is what will make the son of the president of a country to sit in the same house or the same hall or in the same classroom with a son of a farmer. So the children of a prime minister will work in the same office with a son of a pine wine tapper. So when we give our people education, we are helping them to equalize with any other person across the globe. So that's the way it is, and I'm very, very happy that the government is taking education very, very seriously. And I must say at this point that when the governor said he's going to sponsor 1,000 Ebonyians, to be honest, a lot of people were not taking him serious. But when he did it and consistently promote that, I think that what he has done in education is something that the dividends will start manifesting much more in the next 5-10 years. And we could see the impact of that. So Ebonyi State is well positioned to develop in terms of education. So this is, in order to make policy recommendations, I need to do an analysis. And for that analysis to happen, I need to use data. So this data was collected, the data sets were collected from Ebonyi State. The Commissioner for Education is here. He can give me alternative data if you want me to do to repeat this analysis, but I collected this from the government agencies in the state. So we have 1,075 primary schools in the state, and we have about 106,810 pupils in the primary school across public schools across the state, and we have about 6,815 teachers.
Chukwuma, can you hear me, please?
Yes, please.
Your slide is not moving.
Oh, is it not moving? Oh, sorry about that. Can you see it now? Can you see the slide?
Yes, we can, but you're on just from the
It needs to be in slide mode, I guess.
This F5.
Okay.
Run your slide.
Okay, this is it moving now?
No, run your slide.
It's not moving.
Okay.
If you can put it on slide mode.
Okay, I will try something different. Is it moving now?
No, your slide is not on slide mode, so I don't understand. Okay, I understand now. This is because it's online now. It's online.
Your slide is totally gone.
Okay.
You don't have the offline version that you can play from your desktop.
Okay, I have about 2-3 systems here, so I'll move it to I'll move it. Can you see any of them now?
Oh, you are not sharing your screen at this point.
Oh my goodness.
You are not sharing your screen.
Okay, I will share.
Just share your screen, go to slide.
Run.
Can you see it now?
Yes.
Yes, we can see your screen now. Yeah.
Okay. Can you see the slideshow?
No, press F5 now. Press F5.
We can see your data now.
Okay. Okay, I can just.
Okay, it's okay now.
Yes,
you can put it on slide mode. It will even be good for the people seeing your slide.
Yes, so you can remove the page.
Play the slide.
Click here. Okay. Run the slide. Just run the slide.
Yeah. You can play now and see.
Can you see it?
We can see a background, but we don't know.
No, so there is, because I'm using 3 systems, and so let me just continue with the presentation that we done.
Yeah, we can see now. Now.
Let me just no, if I say it, you will go to the second screen, the way I set it up.
Just continue.
Okay, just go ahead.
Yeah, let me continue that way. Sorry about that.
No problem.
So which means that you didn't see anything I presented before.
No.
Okay. Anyway, I was talking about this picture, which I'm ready to. The report presented by the research done by Onitsha Education Foundation, which is very, very interesting, because if we see how the People Charter of Need is mapped over Sustainable Development Goals, and it gives us a kind of an approximation of the impact the state will have if they follow through that document. So that's just what Onitsha Education Foundation wanted to establish. So what I'm going to do is to manage the slide the way it is, because of my setup. So this is the data on primary school, and what I want to say is that this is preliminary analysis. When you have data and you query the data, what's the first impression you get from the data? Is when you get that impression that you now start doing root cause analysis, digging deeper, doing qualitative analysis, collecting more data. Okay, so based on these preliminary data, what can we see? The first thing we can see is that we have a number of teachers per school is low, and the number of pupils per school is 100, and the overall impression is that the enrollment in primary school is low. We don't know why. That is why there is a need to know why. And when I checked the out of school percentage in Nigeria, and also specifically Ebonyi State, ours was 16.7, which is not too big considering the national average. But Ebonyi State may have a target, a state target, to reduce that to, let's say, 5%. Why not? One of the things that I was proud of when Governor Omahe was in power was he refused to accept that Ebonyi State should be regarded as a local people. Okay, so he said no. We are going to show that we can build infrastructures. We are going to show that we can do big things. We can think big. And that impacted on the pride of the people. Of course, we know that Samegu started that. So I don't want to recommend that we should always be trailing behind national averages. I think that Ebonyi State has the capability, and they have shown that consistently, that they can be leading in many areas. And the good thing is that by chance, Ebonyi State now have so many universities. And I can say that universities across the globe drive development, drive industrialization, drive social impact. So with the benefit of that, and with this type of disposition by the state government, willing to dialogue with Ebonyians in diaspora, have a conversation with Ebonyians in Nigeria, even to the extent of also allowing themselves to be vulnerable and be criticized, I think that the states have that capacity to work together and bring all the stakeholders together to begin to carve a future towards the vision of 2050, as has been mentioned by other speakers. So what the commissioner should query is why do we have low enrollment, and how can we improve that? And that will be linked to reducing the number of out-of-school children in the state. So if you look at junior secondary school, you could see that there is an improvement in terms of the number. However, it is still low. And you can now see that because more people are now entering from multiple primary schools, then going to lesser number, so the number is now higher, and the number of people per school is also higher. So what we can see here is that the distribution of students across the state will not be the same. So there are some places where you have higher number of teachers, and there are some places where you have lower number of teachers. So what the commissioner should be thinking about is, how do we create an allocation system that can match the number of teachers with the number of population of students there, and also allocation of infrastructure based on population. Because when a student goes to a school and there are infrastructure, and so that it motivates them. So this is one of the preliminary data. In terms of senior secondary school, that is doing very, very well, and I don't know why. Like I say, this is just querying the data. So the senior secondary school, is it because of O level? Is it because WAEC is required to enter into higher institutions like universities, polytechnics, and all of that? So the seniors, or is it because Ebonyi State is doing well in terms of WAEC, and people are coming from other states to write WAEC? I don't know. So these are some of the studies that can be carried out, and remember that what I'm proposing is evidence-based management, where you have data, you query the data tells you what could be happening, you conduct your systematic research, and then follow it through and develop a policy. Deploy the policy, operationalize it, monitor it, collect data, improve the system. And I think that that incremental approach will help. So the reality is that the government cannot build schools. I used to think that the government can just award contracts and build all the schools, build at least one school per primary school and secondary school. After this analysis, I realized that it's not realistic. That's just the truth. So it's not realistic. And I support the initiative of the government to build ICT. I saw one of the buildings and it's quite massive. So the government can use creative approach. Use creative approach to strategically target these 4 domains. The first domain is getting the children to school and getting them to stay in school because they need that education. The second one is the curriculum, what they learn, the content, and how it shaped their mind. The third one is the teacher training and the recruitment. And the fourth one is the physical infrastructure. So by combining these 4 domains, the government can create their own policy. They can then have something that they can deploy and measure. And like I said, I'm very, very happy with what Dr. Elan said this morning because they re-echo my belief. And I think that with that approach, that the government can really make consistent impact. I believe that if we have a long-term vision that outlasts one government, that we may not be where we are today, because the truth is that the research we carried out last 2 years, the infrastructure before the government, so not 2 years, it should be last 3 years before this government came, the infrastructure was very bad, and the system was not too good. It couldn't support effective learning. But there is a current the deliberate effort to move the state to quality education, and the government should be consistent and continuous in that. So there is an opportunity for Ebonyi state government, Ebonyians in diaspora, and the Ebonyians in higher education institutions. There are a lot of faculties of education in Ebonyi State now. Federal College of Education Technical, the ISU, they are the brand new college. We have a Ebonyi State Faculty of Education. We have FUNAI. We have Faculty of Education. I think that there are professors. In fact, I tell you what, professors are just paid to research, to solve problems. So the government can have an arrangement where they can get these people who are hungry to research, who are hungry to create knowledge, and have a way of getting them to find out strategies on how to mainstream cutting-edge knowledge into these 4 domains. Okay, I was happy when Dr. Elan mentioned digital platform. Digitalization of education and digitization of education is one advantage the government can take to reduce the deficit. Because with education, different schools can log in onto a platform, a common platform, where that curriculum, teacher infrastructure will not be limiting students to learn. And now we have a lot of open access resources across the globe that the students can learn from. So by working together, we focus on operationalizing a synthesis of UNESCO standards, SDG framework, national policy on education, and the People's Charter of Need. And that will customize and conceptualize education policy within the state. Not doing it the way other states are doing it or the way it is done in Nigeria, but a practical approach on how Ebonyi State can have parameters and key performance indicators that they can pursue as a state and lead, if possible, within Nigeria. So in summary, I want to, the Education Foundation wrote the Honorable Commissioner the other time there was a release that private schools that are not, that are substandard should be closed. And we wrote to appeal to the government not to close many schools, because the finding is that the private schools and faith-based schools are supporting to supporting the deficit in the public sector. And I support closing down schools that are not ethical in nature. But if it is a school that lack infrastructure, the government can structure grants. The government can support them with guarantee. You can guarantee them. They will take loan from banks. You guarantee them, and they will repay the loan. So education, whether the person went to public or private sector, is still education, and they are still within Ebonyi state domain, and is going to support the state to achieve its educational goals. So improve the policies of, so focusing on that link, which is the basic education, amplifies the enormous investment the government is making in tertiary education institution. Unless other people from other states will come in to enjoy the infrastructure, I think that Ebonyians will be the first beneficiary of the fantastic universities, that is being built in the state. So how to prepare our people to take advantage of that is to grant them basic education, which is good primary school, good secondary school, and good senior secondary school. With that, they can go outside the state or within the state and get advanced education or further skills. So there should be some kind of education zones, because I do believe that the government will not have all the money to fund the infrastructure in the education side, even if they want to. So there should be a kind of zoning where most of the good infrastructures, like I said, I had the privilege to see one of those 39 secondary schools new buildings that the governor funded. So imagine that other secondary schools, including private, they have access to that facility, and the community also protect it. Borrowing from what Dr. Laz said in terms of communities protecting the infrastructure, educational infrastructures in the community. So I think that Dr. Laz and Commissioner for Health, as you people are developing education health committees, I also recommend that there should be education committees. The town unions, when they should have health committees and education committees. And those education committees, we now mobilize the community to see how they can protect the infrastructure, the health and the educational infrastructure, because it is what the community needs to live healthy and also get to the next level. So I've recommended leveling. Okay, if there should be a system to allocate teachers and motivate them to stay where they are posted to and contribute to those communities. And finally, I want to say that more teachers and more resources based on the ratio is needed. So the Honorable Commissioner, thank you for the 2,000. It's as if because I promote education, the 2,000, I'm very, very happy. But like Oliver Twist, I still want to ask, please keep recruiting, because the ratio is still low. And while you are doing that on the human capacity development level in the education sector, also look at how you can use a hybrid approach while you are building new buildings, repair the old ones. And also you can have a model where the people who have the skills to repair buildings from those communities can be given, the materials can be bought for them, and they can use their town union to repair their primary schools and their secondary school. I think that the government can, and let's assume that the government put 2 billion to repair all the old buildings in the state. With that 2 billion is direct level. All the communities will mobilize their builders, bricklayers, and all of that. It is possible. They can do that. And I think that the people will be very, very happy to also do that. So with this, I want to say a very big thank you to Right Honorable Valentine Okike-Uzo for allowing this and working so hard for this to take place. And I also want to thank Dr. Inyoko for all the background work and also for the moderation. So thank you very much. Once again, I'm not a politician. I'm an academic, and I speak to data and I listen to data. So I think that it's about continuous improvement. We cannot be perfect in a day. We can improve and learn from one another and continue to contribute to the development of our dear state. Thank you very much for the opportunity.
Thank you so much, bro. Thank you, everyone. I think we are now in the open floor session, and we can ask questions to the speakers, but we need to keep it brief as possible. So if you put your hand up, I can call you up to ask your questions, and we take it from there. I think, Chukwuma, you can stop sharing so that I can just see. I wanted to check if any of the government officials are still online, just in case you want to ask them any question. I want to beg that we'll keep it respectful. We are here to have a conversation between us, and I want to acknowledge that having divergent views is not something that is unexpected, especially when you have very intelligent people gathered like we have here today. So please, if you want to ask a question, you can put your hands up and I can just call you up and you can go ahead and ask your question. Before that, the Commissioner for Health had made some comment, and Dr. Laz wanted to respond. So I want to start with you, Dr. Laz, if you can respond and provide your comments. Unfortunately, the Commissioner for Health is no longer on the call. So, but yeah, you can give your comments. I'm sure that will be good for everybody's consumption. Thank you.
Yeah, thank you, Dr. Nyoko. I would prefer that maybe people who have questions related to my presentation or comments may ask, then in the process of responding, then I could share other thoughts. Thank you.
Very good. My brother Paul Manko, please.
Good afternoon, everyone. I don't know whether it is still afternoon in Nigeria. We are just 3 hours ahead in Brazil. So I wish to just commend Dr. Laz and Dr. Ogbonnaya, if I'm right, just to say that my submission would be that we need to get the government to see especially issues of public policy, education, health, energy, and all of these things. I think maybe our recommendation, maybe I think I'm ready, because this might be, I just got to know about this, so I had to delay my meeting, one of the side meetings I'm attending. But I just want to say that it is important that maybe we have a paper to, because if we can't get the government to get to a point where it does not see education, health, and some of these HDIs as, political, what they call dividends of democracy, something that they are giving as charity to the people. When it becomes a right, the government sees it as a responsibility, a reason why it is in office, such that it does not expect to receive accolades for doing exactly some of these things that affect the life of the people. Reason the government is there in the first place. And I just briefly, I just wanted to say that I'm very fulfilled, being a part of this, because I had been advocating that, the state has come of age. We can have our people contribute to the development of the state from wherever we are. Where I did some work in the past with IOM, ILO, and UNDP, and I have been trying all the time, because I know states in Nigeria that are currently benefiting from the, just a little goodwill to this international organization being present in the room where these decisions are made. Here in Brazil, the stakes are high, and I'm happy that people wanted to discuss something about energy. My paper on the side event on climate financing was on energy poverty and the nexus between climate change, conflict, and migration in Nigeria. So, and it formed one of the resolutions that came out from this call. And I'm happy that people wanted to discuss on energy, but I think the opportunities are there. We just need to have the people in government who are interested in what is happening and be part of the discussion, so that we can begin to bring some of these things home to for our people to benefit from it. I didn't see participants. Nigeria had one of the largest delegations here, but I think I didn't see participants from Ebonyi State. I think I noted someone, but he didn't come from the governor of, or government of Ebonyi State. I think the person come from another international organization. So these are some of the things I think we could be, getting the opportunity. I remember I wrote to the government of Ebonyi State that this meeting is coming up and we need to be there. I didn't get a reply, but I'm sure maybe they will, in the subsequent COPs that will be coming, Ebonyi will be represented. Thank you, the organizers. I may be off, but I'll be in a listening mode until the meeting ends. Thank you so much. Over.
Thank you, my brother. Thank you so much, and it's good to hear from you. Yeah. So, do we have a Paul Manfo? Yeah. So, we had other people that had raised their hands. Where are you all at? Yeah, Kingsley Onya Magri, please.
Thank you. Good afternoon, everyone, once again. I'm Dr. Kingsley Onya Magri. And thank you, Dr. Laz Ude, for the extensive lecture. I think he spoke a lot about the issues at hand, the issues that have been deviling the health sector and the quality of healthcare generally. And also put down well, since as expected, but of course,
Hello, are you there?
we can only get to know the truth that will be able to solve what is at stake. It's unfortunate the Commissioner of Health is not presently this meeting, but my submission would have been helpful when it comes to emergency health medical services, where my interest particularly lies in. There are a lot of opportunities in the health sector, and I think we don't tend to see them. And perhaps because we are looking at it on the angle of the cost effectiveness that the cost toll that it will take on the government as against the impact it will have on the citizens. Because it also boils down to the economic importance of this health thing, because every other thing revolves around health, including the education we just talked about. The child doesn't get quality health in pass on the state, because the state will spend more, and not only spending more, the value the state will now get in return as a result of poor health. So that's basically what it is. So I commend him extensively for the whole lectures things, and I would like to look into my own contribution is in more like an addition, judging from where I work. Here in University College Hospital, a lot of things are done by collaborations. The tertiary institutions collaborating with state and even the private and so on and so forth. So I don't know, because like I said, I had expected the Honorable Commissioner to be on seat so that he throw more light on it.
If you are not on the call, if you can put yourself on the mute, please. Yeah, thank you so much, Kingsley, for your contributions. Edwin Okoro, please.
Hello, am I still audible?
Yeah, Kingsley, are you still talking? Okay.
Oh yes. Sorry for the network breach. Okay, so my contribution is this. Now we have some established institutions, like we have the College of Health institution. I don't know how the effort we are making to upgrade it in such a way that it offers some courses that are relevant to the cost of the government project. Take, for instance, in emergency medical services, We have College of Health Technology that ideally should offer courses like paramedics, which is quite very obtainable. We can partner with teaching hospital, partner with the doctors and health workers already established in the state to see that they offer trainings in areas that are relevant to emergency health services, which at the end of the day, we don't need, to employ from the outsiders to make up the health sector. Just use our in-house resources. So that idea would make a lot of, we create job opportunity, not only create the job opportunity, also develop the indigenous brains so that at the long run, when we want to scale up, we'll have manpower employed that will create the enabling environment for our people to get engaged. So that's the angle I was looking into. So where I'm rounding up to is in terms of collaboration. The College of Health Technology, which is already established, can have visiting lecturers that will earn them the accreditation to do some medical courses, which is under their purview, so that when projects like this emergency medical services is established, we will have manpower to man the services that the government has implemented. Then on the angle of financing, just like Dr. Laz presented earlier, there are some activities in the state already, town unions and which the government can key into because they may not be in the books, but this is part of our culture. And if we don't look inwards, we may not actually achieve that which we are meant to achieve. Like the National Health Insurance Scheme processes is there. Then they've implemented the state health insurance scheme. Most of the state health insurance scheme may be applicable to civil servants. But if we want to expand, there's a way in which we will go about it that even the non-civil servants can be integrated into it so that they will have enough funds to ensure that this health insurance scheme, it progresses. What I mean is, now we have if by age grade, I know they do contributions, they has monthly, weekly, as the case may be. So if by age grade level, they are billed a certain amount for which they generally contribute, and they make that contribution and contribute generally into the National Insurance Healthcare Pool. It now gives your leverage the opportunity for anybody of that particular age group identified as a member to have access to the health insurance for which the state is creating, because going by individual, they probably will not get the number and and also the willingness of the members to join in those schemes. And so it will now be only left for the government employees to be enrolled. And so these are the things that I feel that we should look into. And that's the area that I perhaps thought Dr. Laz had talked about when he talked about community participation. It's not just only by engaging the community health and everybody, looking inwards to what are our practices in our own environment and how do we integrate our practices to the insurance scheme that is the normal scheme that is already in operation. Thank you very much.
Thank you. Thank you so much. Thank you for your comments. It's good to hear a very deep comment from someone that works in the health sector. You are a health worker, I want to understand. Is that correct, Kingsley?
Yes, I'm an emergency medicine. Yes, sir.
Nice to meet you, sir. Edwin Okoro, please.
Good afternoon, everyone.
From government college, please just become part of your life. So I hope everyone understands.
Please, I don't know. Can you hear me?
Yes, we can hear you very well.
Yes, before I proceed with my comment, I don't know if we still have the government officials on ground so that the aim of this thing will not be defeated. Because if it's only the diasporas are interacting,
no. The Honorable Commissioner for Special Duties is on ground.
Okay, that is very wonderful. My name is Edwin Okoro. Yes, presently I'm a student of SFUE, Federal University of Technology, doing my MSc program. So I just want to thank my good brother, Dr. Chukwuma Good to see your face once again for a very long time. And in the area of education, I don't really know because we are talking of Ebonyi State in 25 years from now, what's going to look like, what's going to be. I'm looking at education. Let me just give you a core analysis, practical one. When some of us were in secondary school, we hardly see any teacher. We say that this is our physics teacher, this is our chemistry teacher that we had that remained there, apart from those who come to visit or just do a helping hand. But I must submit to you today that if you have up to 20 students that did sciences with their certificates, and they will not be up to 10. 10 is being much, or 5 of them I can comfortably defend that their chemistry, they say they had A1 or they had A2. But at the end of the day, they serve for sciences, they pass the subjects, but go to that school, you will not see any science teacher. I don't know how we're going to do it. It's a serious concern. I had the opportunity of doing some part-time lecturing in an educational foundation of Alice Ekweme Federal University, their pre-degree programs. Some of the students that come to want to teach them chemistry, they don't even want to call atom. They begin to wonder, who are we heading to? So I don't know what we are going to do, per se, in 20 and maybe 25 years to come, how we can consolidate this knowledge. It is not enough current certificate, yet it's good. You can secure admission and read whatever you want to read. If you are talking a sustainable development that has to do with human impact in terms of competing with the world and bringing something positive, then there is an urgent need for us to really assess our students based on what they are coming out with and what they are having as a certificate. Today, many parents don't believe that the students can sit down and read. I don't know where the problem is coming from. So if you are talking of infrastructure, building schools, building that, thank God for our governor today that was able to recruit out to 2,000 teachers. But I want us to do more. Let us consolidate on the teachers and look at their remunerations, because if all the subjects are being given the same amount, if somebody finished from university as a first-class student and you pay him very well, the person working in share and person coming to teach in a classroom, at least he wouldn't even mind, no matter the kind of certificate acquired, as far as can make that human impact. I think there is need, an urgent need indeed, that we restructure ourselves, restructure, repackage Ebonyi State in terms of the quality of our students, the quality of teachers, the infrastructure, and the learning environment, the materials available. I think it will go a long way. Thank you for my brother Chukwuma, who made very viable suggestions in terms of how to equip our education to cope with the standards and challenges ahead of time. Thank you very much, and God bless all of us.
Thank you so much. Thank you, Edwin, for your comments. Our brother Emmanuel Umoke, please.
Good afternoon or good evening, depending on where you are in the world. I am Emmanuel Umoke. I would like to start by thanking the organizers of this event and also the presenters, especially Dr. Ogbonnaya. I live in the UK, and one of the things that I find very exciting are some of the things that we've heard so far. I met Barrister Okike when he came in, when I was the president of Ebonyi State Union, UK and Ireland. And there were quite a lot of discussions that we had, and I'm so glad. Most of them had to do with the People's Charter of Needs. Most of them are being implemented, so kudos to you and the government. Now, I understand a lot of stuff that have been discussed around health, education, and the likes, but we also need to focus on security. We understand what's going on in the country at the moment with all the killings and all that. It's Christmas period now. I pray God's protection on us, but as we have seen, these people are now attacking people even in churches. So prayers that Lord wouldn't cut it. What are our plans? And I use the word "our" because security, apart from being the first priority of government, is also everybody's priority. what are our plans to ensure that our people are returning home during this Christmas period and for, later on are protected? That is one. The second thing is the projection for such a length of time around some of these plans help. One of the things I find very interesting um, is our ability to plan, our ability to put things on paper. I hate to sound pessimistic, but as against having a 50-year or 25-year plan, we could also have a 5-year plan, a 10-year plan, because one of the things we've known over time is that government would come in and they want to do their own thing. Maybe because they don't want, legacy projects, they want to leave their own marks. It'll be great for us to be able to have such, short-term plans, but also having long-term projections as well. Thank you all. Thank you.
Thank you so much, Brother Emmanuel Umoke. I will leave the answers to your questions, some of the comments. So we'll probably have responses from Chukwuma, from Honorable Valentine, maybe if he wants to jump in. Yeah, but the floor is still open for everyone to throw in their points. Chukwuma, your hand is up. You want to add something?
Yes, I just wanted to ask our colleagues, particularly lecturers in EBSU and all college and all of that, other institutions in the state, what do they think that this partnership between what do they think about the partnership between the states, state governments, the higher education institutions, and the Ebonyians in diaspora? Because what they think is very, very important. Given that we want to make it an annual event, I would want to get input from any of the academies from the institutions. Thank you.
Thank you so much. I'm sure we have some of our brothers in the room at the ICT EBSU who are lecturers within the university. Please, this question is for you guys, and feel free to jump in.
Okay, can you rephrase the question? Somebody wants to talk here.
Okay, so the question. Okay, so the question is this: the bigger plan is that this type of conference we've had today will carry on as an annual event, and it's going to hopefully become a platform where the Ebonyi state government, the academics, and even businesses based in Nigeria and the ones abroad will all come together to talk about issues that concern all of us. He's asking your thoughts about this type of partnership. Yeah, what are your thoughts about this partnership, about this kind of conference going forward into the future?
Okay.
Yeah, please go ahead. Just introduce yourself.
Okay, my name is Vincent Obinna from Academic and Federal Polytechnic. Mona?
Yeah.
Yeah, thank you so much for this platform that has been created today for us to brainstorm on how to make Ebonyi State a better place for all of us. The idea of the conference holding as an annual event is a welcome idea. And I think it is feasible if we could start early. The issue of, like, there's a suggestion that was made online, making it where people can present papers and certificated. So if we start planning early on that, that will help to improve on attendance and participation. I also wanted to speak on the situation of schools in Ebonyi State and the recruitment of teachers that the governor has just done 2010. That's a good one. And from analysis that Dr. Chukwuma made here, we discovered that it is not sufficient yet. And like Oliver Twist, he did ask for more. But my worry is that if you go to our public schools today, you discover that the teachers are poorly motivated. And because of the poor motivation, I think that could be the reason why when parents allow their children to public schools, it is not that most times they don't stay in the class to learn. Teachers take them to their farms in the school and then getting exhausted and coming back home to sleep off at night, not doing another thing. So I am thinking that the government should not just end at recruiting teachers. They should also make efforts to motivate them and make sure that they are doing the work they have been recruited to do. That will go a long way to ensuring that the little efforts thus made will also bear meaningful fruits. Besides that, when the teachers are motivated, you discover that some other good hands will want to join the teaching profession. There are so many people who read education who are supposed to teach. There are some other persons who have the gift of teaching. But because of the way teachers are being handled, you see them looking for elective offices or maybe being PA to one political appointee or the other, thereby causing brain drain locally, people that could be more meaningfully engaged in developing our nation. Thank you.
Thank you so much, Victor. Am I right?
Yeah, and to add to that, Dr. Enyoko, the points raised by Laz was very germane, and Dr. Chukwuma also buttressed it, and that is the importance of monitoring. The commissioners for education and health have to sit up and do proper monitoring. They should motivate. Thank God the commissioner for health said that they had bought motorcycles for people to go to rural areas. So I can assure you that we will do all that to make sure that they monitor schools and health facilities, just for more adumbration on what is being said here. Because when Laz said that you go to hospitals and you don't see equipment procured by the government, it happens. But this has opened our eyes more to go back and check, because some of them, they would have had it to their private clinics. It has happened a number of times. And I can assure you, do the local monitoring, using the beaches of communities, presidents and all that to do that. So we can assure you that.
Thank you so much. That was a very brilliant comment, actually. And to be fair, this was the sort of comment I expected from the Commissioner for Health. There was no need for back and forth on that. So thank you so much for pointing that out. Dr. Laz, you want to add something?
Yes, thank you very much, Dr. Nyoko, and thanks to everyone that have been part of this from the beginning. The issues I highlighted, I was expecting the Commissioner for Health, in addition to making some clarifications, to also make some kind of policy statements and to say, okay, yeah, some of these points are well taken. Going forward, this is certain things we are supposed to do. I think it's important that we begin, especially some of our brothers and sisters who are in positions of authority to see that as an institution that outlives them. People were there before them, who will come after them. And this institution is serving the people. So imagine if anybody that needs information begins to call the Commissioner for Health or begin to write to the office, I believe they will be overwhelmed, just responding to these public inquiries. We are in 21st century, this is 2025. Data or information for the public shouldn't be treated as a privilege. If you need it, just call me to get, there's a limit to information that the state can provide. The state can provide information on this is the health facilities we are intervening, this is the equipment we've provided, but they will not have the information on whether those things are being used for the people. So it should be a 360 system. You give information from the supply side, and you also take information from the demand side, from the people's side. And if we have a website or a portal, or so where this information are easily accessible. I'm not sure the commissioner is still there, but there are 4 wards in my community, and I usually use my community because I visit all these places. In April, I was in Afikpo as well, where I visited some facilities. I visit even up to, what's the name of this place? Ameta Osisa, or Agba Osisa, a very rural settlement that only got a bridge recently. Before then, people walked through water to access the place, So, and I've also been to some locations within the SR area, to know what is happening. So we should be open to this information on where things are working and where it's not working, to find out more and see how we can work with the people who are there, to solve these problems. The 4 wards in my community, the ward focal facilities, there's no substantial intervention that's been done, except in one where there is a building going on, and I've observed that that building is substandard. So the other 3, there is no major investment, and I've been to each of them within the past 4 months to know what's happening. Another point is there is this basic healthcare provision fund, which is a fund from the federal government. I was one of those that led advocacy for National Health Act 2014, and between 2014 and 2018, I was one of those that pushed for the release for the budgeting at the federal level for these funds. We had to engage at the level of the Senate President Saraki, the Minister of Health then, Professor Adewale, and so many other persons for there to be a budget. And the first release of that basic healthcare fund was in 2019, May. So now the money is being released on more regular basis. So the point I made was, apart from the ward development committees, which are existing, we need to have community health committees to also exist and be functional. The monies that are being released as basic healthcare provision fund to health facilities, which mine is one of them, is less than what is being released at the federal level. So if the commissioner could make the official of what is being released, then we'll be able to check it with what is coming from Abuja, because recently the Minister of Health wrote a red letter from October, on monies that are released to the states. I have data from the national level, what gets to Ebonyi Health Insurance Agency, and what gets to Ebonyi Primary Healthcare Development Agency. And if you divide by 171, what is getting to my own health facility and what the ones in Afikpo told me they are getting, is far below what they are supposed to be getting. So we need to know where the balance is going to. And again, the manner it's getting is also prescriptive. They are told what they use the money for, instead of them, making their plans based on their needs, because the needs of my health center might not be the needs of a health center in Ikwo. So being at the state and telling them, okay, make budget for solar, for example, where some of them may already have solar, it's not going in tandem with the intentions of that fund. So I just use this as an example that our goal should be for the state resources to work for the people. There was statements that the state governor made in his home, I think December 2024, thereabout, on health. And I could see that there's some kind of intention, things he wants to see, from those statements. You know, he needs to be guided for those statements to translate to results that the people will be like, okay, yes, the governor, this is the wish he wants, and it's happening. At the moment, I think there's some kind of disconnect between some of these interventions and the results we are seeing. And we need just to be open-minded about it and not see it from the prism of criticism or people looking good or bad, but see it from the point of there's no perfection here. So the areas things are going well and areas things may not be going as intended. And we all need to work together to get the best from the efforts. So with that, there will be trust, there will be confidence of the people, and even for those who might want to invest, external people who might want to invest, some of whom we have access to. But when they are not seeing that the government investment is really translating to excellent results for the people, they might be skeptical about channeling their investment in that regard. So thank you very much. I could say a lot of hands up, so let me stop here.
Yeah.
Thank you.
Thank you. Thank you so much. One of the things I take away from Dr. Laz's comment, which is what I was trying to point out to the Commissioner of Health, is that it's not reasonable to expect that anybody that wants information about the ministry will have to come to the office of the commissioner. That is not a reasonable expectation. And of course, this is part of the things that is going to be contained in the document, in the recommendations that we'll be passing on to the government, that the ministry, for instance, should maintain a channel that people can access very general information about the interventions, what they are doing, etc., etc. That is even very good for him. It saves him a lot of headache and a lot of hassles, trying to explain himself. And I believe that this point has been well noted, and Honorable Valentine is here, and he's also noted them, and we pass them on to his colleagues. We are also going to prepare a summary document that will highlight some of these comments and pass it forward to them. Hopefully, all of this can help drive some of the change that all of us are hoping for. So I come to Nelson Nkwo. Nelson, Brother Nelson, please.
Yeah, thank you. Thank you very much, Dr. Oko. Once again, I want to thank the presenters. And let me respond to the question that our brother, Dr. Chukwuma, challenged the academics in the House with in terms of the laudability and our view, our take on this tripartite meeting. I want to say it's a commendable one. It's a laudable one indeed. However, in my own view, what have been, what I have been tinkering on, or what I said, I think we should look into in order to see that the aim of this conference, this tripartite conference, the Ebonyians and Diaspora, the government, and those that are within, survive beyond the present administration on the issue of trust building. And, that the truth remains that once government is involved, in some projects, that the first challenge you face is issue of building trust in the, in the stakeholders, because essentially, because of inconsistency in policy and the changes after government administration, lack of continuity in most cases. In a meeting like this, some people will be so skeptical, believing or thinking that after the present government, for instance, if the commissioner for the focal person is not there, if the present government, His Excellency, is not there, who is a visionary, or rather, who has bought into this vision, the next government that's coming, will this, survive the next government? And that will make a number of persons to be skeptical about such. So I am challenging us especially those of you that are in diaspora that are, driving this, to see how we build in trust and confidence to those, especially those that are down here in Nigeria. Of course, oftentimes, it is those that wear the shoe that know how it pinches them. Of course, taking from, for instance, some of the issues that are going on with the government and the academics in Nigeria could tell you, some of these stories I'm trying to, present. So for the policy, for the program itself, it's a laudable one. For the program itself, personally, I believe in it. But the question is, will it be able to go beyond possibly the present administration or next administration, where the continuity is a guarantee? So let's look into that and see how we're able to do that. Then on the issue of education that Dr. Ogbonnaya presented his own thought and view about, I was also thinking that it's important to look at how to improve on maintenance culture of infrastructures that we have in our public schools. We should know that, of course, in our days, we don't have all these private schools. It was all through public schools. And the quality of education, the accessibility, the quality, and all that were higher than what we have today. Then in terms of infrastructure, we discovered that those old buildings, that strong structures that we have in our public schools. I don't know about your area, but for instance, I went to the village last 2 weeks. I went to a primary school behind my village compound, and I was so surprised that the old buildings that were even stronger than what you could have today, they are all in deplorable situation. And the primary school I attended in one of the villages in Isiama, and in short, the situation is a pitiable one, that the old buildings, the issue of infrastructure, we are more interested in building new ones that may not be as strong as the old ones. So what happened? Is there no way government can improve on the old infrastructure? Because the truth remains, as much as we are talking about financial incentive, monetary incentive, the working environment is also important. And you discover that most of the teachers, because of deficit in infrastructure, don't even have offices, that helps to, to help them in their work. So what I'm saying is that it's important that government should also not just build thinking on building new ones, but also think much more on improving on the maintenance culture of infrastructures that are available in our public schools. By so doing, some of this gap that is created by government not meeting up in some requirement that now give room for private schools to be springing up here and there. More recently, the Commissioner for Education, His Excellency government through the Commissioner of Education came up with some policies that are so laudable. Of course, in terms of school, the textbooks they are using in schools and all those things, that the government is trying to come up with policy, are things that if the public schools are functioning as it were in our days, we use lacum. But now, in primary, private schools now, if private individuals catches into it, and the people that are suffering, the suffering it are parents. It's good enough the government is now coming up with some policies to reduce, the exploitations that private individuals that are providing the educational gap. They trying to bridge the gap that sorry. Hello, are you hearing me?
So we can hear you. I was just trying to call on the attention of Mr. Moderator that we have spoken so well, but take too much time in. If he gives me time, I'll talk.
Just what I'm saying is that, so what I just said is issue of trust to sustain what we have started, then improving in infrastructures in public schools. Thank you very much.
Mr. Moderator, sir.
It seems the moderator is not here. I think we will
just make one.
Yes.
One comment. I believe that I believe that the reason why we are having this conference is to have a pathway between the government, the people, and our brothers in the diaspora. And one of the reasons also is because some of you who are across the oceans have gotten some kind of expertise that we don't have here. How do we bring those things down here? Every problem cannot be solved by the government. I'm replying in response to one of the points that Nelson raised, that there were buildings that are supposed to be maintained, but government is building new ones. And I want to say that government cannot do it all alone. We want to see how some of our diasporans can invest in the states. This is one of the reasons we're having this conference. And I know we have spoken too well. Let the moderator not give too much time. Somebody wants to make a comment. 1 or 2 minutes is enough because he has actually ended up making a lecture. Please let us, be timeous in our responses, and let us also know that government has also done so well. Every statement made here, even though the respective ministries or commissioners are not here, but I am also representing the government. I will make sure that everything is reported back to them. And obviously, for the organizers to have, a compendium of all that have been said, so that government can look at it and see where they can also improve on what they're doing already. So that my point is that we should make our questions or comments very brief because time is fast spent. A lot of people came all the way from my people. They'll be going back. And that's just my comments.
That's okay. Thank you so much. I'm sorry I had some back and forth with the children. Okay.
Doc, I was actually trying to send you a text message to say that I think we should go to vote of thanks so that we can conclude, given that the items are finished.
All right.
Thank you.
Okay, so thank you, everyone. Although somehow I think we are just about bang on time with the time we had hoped to close for today. The vote of thanks from the government, represented by the Commissioner for Special Duties. Please, if you can just give a vote of thanks on behalf of the government, and we can wrap up and close. Thank you. And sorry for the people that their hands are still up. Sorry for the people that their hands are still up. Hopefully, at various.
He has spoken. He has spoken. Nkwa has spoken.
Okay.
Thank you very much. Thank you very much. I want to thank all of you, especially Dr. Chukwuma Ogbonnaya, Eli Oko, and so many of you for a job well done. Laz, I'm just meeting for the first time, but he has spoken so well, and I'm hoping to get in your contact so that we can talk, privately. Let me say that the government of the day, led by our governor, Right Honorable Builder Francis Ogbonnaya, is a man who is ready to work. Is a man who needs our input. Most of you